Have you ever wondered what happens when your body's most powerful messengers just go rogue? Well, today we're diving headfirst into a medical mystery where the clues are hidden in plain sight. This is Hormones and Electrolytes, a diagnostic puzzle.
So, hormones are basically the chemical text messages that run our entire bodies. But what happens when they start sending the wrong signals? Or maybe no signals at all? The results can be pretty severe. And often, the very first clue we get is a simple electrolyte imbalance, something you'd find in a routine blood test.
Okay, let's get into it. I want you to think of this whole thing like a crime scene. The body's in distress, and the only clues we have to start with are the levels of sodium and potassium in the blood. By following these tiny clues, we can actually unmask the hormonal culprits behind some really serious conditions.
So, our first big puzzle centers around sodium. You see, low sodium is a major red flag for doctors, but the reason for it is the real mystery. Is the body basically drowning in its own water, or is it losing salt at a dangerous rate? The answer, well, it changes everything.
So picture this. A patient comes in, they're confused, they're lethargic. You run their blood tests, and bam, their sodium is dangerously low. But here's the weird part. They don't look dehydrated at all. So you have to ask, how can someone have low sodium without actually losing water? What is going on here?
And the diagnosis is SIAD. You see, the problem isn't a loss of salt, it's an excess of water. The body is holding on to so much fluid that it's literally diluting the sodium in the bloodstream. It's like adding way too much water to a perfectly seasoned soup. Here's a great way to think about it. The hormone ADH, think of it as your body's water warden. Its whole job is to tell the kidneys when to conserve water and when to let it go. But in SIADH, the warden has gone totally rogue. It's like the faucet is stuck wide open, and the body just keeps holding on to water no matter what.
And this is how we really nail the diagnosis. These are the fingerprints left at the scene. The patient has a normal fluid volume, what doctors call euvolemia. Their blood is all diluted with low sodium and low concentration. But their urine tells the opposite story. It's super concentrated and packed with sodium because the body is desperately trying to hang on to every last drop of water. Classic SIADH. All right, now let's introduce a new suspect. In this case, we have a post-op patient. They're weak, they have low blood pressure, and they have low sodium. Sounds familiar, right? But this time, there's a new, really striking clue. Their skin is turning a darker, almost bronze color. This patient has Addison's disease. And here, the problem isn't too much water. It's a critical shortage of two really important hormones from the adrenal glands, cortisol and aldosterone. Without them, the body just goes into a total salt-wasting crisis. So if ADH is the water warden, then you can think of aldosterone as the salt saver. Its job is to tell the kidneys, hey, hold on to that sodium. But in Addison's disease, the salt saver is gone. The kidneys just can't hold on to salt anymore. And as all that salt gets lost in the urine, water follows right behind it, leading to severe dehydration. So you can see how different the clues are this time. We see obvious signs of dehydration. Blood sodium is low, sure, but it's because it's being wasted. But here is the real kicker. The potassium is high. That is a key piece of evidence that points away from SIADH and directly towards Addison's. And check this out. This diagnostic flowchart is basically a detective's playbook. A doctor starts with that low sodium, then they check the patient's fluid status. Are they dehydrated? That path leads to suspects like Addison's. Or do they have normal fluid levels? Well, that path points straight to SIADH. It's a perfect example of that clinical detective work in action. Okay, we've seen how sodium can be a master of disguise. But what about its partner, potassium? Our next puzzle involves high blood pressure and a serious case of mistaken identity that can fool even the sharpest of clinicians. So here's our next scenario. A patient comes in with stubbornly high blood pressure and muscle weakness. A blood test reveals low potassium. Now, on the surface, the clues seem to point to a pretty clear diagnosis. But looks can be deceiving. Because these exact same clues, high blood pressure and low potassium, can point to two completely different hormonal problems. It's a classic case of medical doppelgangers. So the big question is, how in the world do we tell them apart? Our two prime suspects are Cushing syndrome and Conn syndrome.
They show up looking strikingly similar, but they're caused by two totally different hormones going on a rampage. Now, this table is just fascinating. Look at this. Both conditions cause high sodium and low potassium, which leads to high blood pressure. They're basically identical twins based on these first tests. The key difference is the rogue hormone. Too much cortisol in Cushing's versus too much aldosterone in Conn's. And what's really wild is that at super high levels, cortisol can actually start to mimic the effects of aldosterone, which is exactly why they look so similar.
So, to crack this case, we have to go deeper than just electrolytes. We actually need to measure the hormone levels themselves. We have to ask, is it cortisol or is it aldosterone that's out of control? That's the test that will finally unmask our culprit and get us to the right diagnosis.
All right. We've investigated 4 different cases, each with its own hormonal villain. Now it's time to put all the pieces of the puzzle together and reveal the master key that cracks this entire code.
And here it is, the master key. Look at how it all lays out. SIADH, too much ADH, which gives you diluted low sodium. Addison's, too little aldosterone and cortisol, leading to wasted sodium and high potassium. And then our doppelgangers, Cushing's and Conn's, both with high sodium and low potassium, but driven by totally different hormones. Each condition leaves its own unique fingerprint on the body's electrolytes. So, the crucial point is this. Just by looking at 2 simple electrolytes, sodium and potassium, we can start to uncover the secret language of your hormones. These aren't just numbers on a lab report. They are vital clues to really complex conditions hidden deep inside our bodies.
I mean, it's pretty incredible when you think about it. These microscopic messengers, these tiny shifts in salt and water, they wield such immense power over our health. It really makes you wonder, right? What other complex and delicate chemical ballets are happening inside all of us right this second? Something to think about. Thanks for joining us.